Some 6 hours later, I'm called by the nurse in charge of maternity, and she tells me, "Doc, you remember that mother with twins?" And I told her yes. And she told me, "I think we are stuck." So I asked her, "What do you mean stuck? Do you mean stuck like she has not delivered?" She said she delivered her first twin almost 2 hours ago. We have not delivered the second twin. Our vaginal examinations are usually warranted. By the time somebody is doing a vaginal exam that is not warranted, that is a sexual assault. Yes, even for healthcare providers.
Okay. You are welcome back to the Mamatoto Lounge. Thank you so much for keeping it here, for your subscription, your questions, your share. We are so glad. And remember, we do this for you because we believe everybody has a story. My name is Rosemary Shikari. I am a doula, a childbirth educator, and lactation specialist. For today, I am the host, hosting our guest in the show. He is a doctor. He'll tell us more about himself. But where are we? We are at the Little Cave Kisumu in Tomboya Estates. This place offers very good accommodation, no noise at all. You'd rather visit here. And there's a restaurant as well. Please come and pay them a visit, and you can also host your many guests whenever you can. So, Daktari, karibu sana, and it's so good to have
Asante.
you. Your time is precious. So for every minute that you're here, know that we are very much indebted. Let us know yourself.
My name is Onyango Ndonga. I'm from Kisumu, Nyakach, Koguta, for those of you who are from Kisumu. Born and bred in Eastlands, Nairobi. I went to school in for primary school. I went to Nyabondo Boys Boarding. It's up here in Nyakach. A very good experience for me. In fact, it's a Catholic school. That time I wanted to be a priest, and it was something that I really took very seriously. I'm a very pious person.
Okay.
For high school, I went to Lenana School in Nairobi. Also a whole new different experience for me, because I came from the old school Roman Catholic stringent school to a very open liberal school. There's a famous saying that Lenana School does not have a fence around it. So what I learned from that experience is, choices and consequences. There was nothing as vivid as that from my high school experience. It has shaped how I live my daily life. I know I can choose to do some things, and I can choose not to do some things even if everyone is doing them.
It. Okay.
Yeah. For my undergraduate, I was in University of Nairobi. For my postgraduate, I was in Moi University. I know you're smiling because that was very recent, but it is in my past. Anything that happened the past 1 minute is in my past. So yes,
true.
For my postgraduate, I was in Moi University.
Beautiful.
I specialized in obstetrics and gynecology. Hopefully, in the next few years, I might be even further delving into fetal maternal medicine.
Oh.
Yes, that is something I am also very passionate about. So uniombe.
Tutakuombea tena sana. And we are wishing you all the best. We really, mothers and children really need you.
Very much.
Yes.
Very much.
Yeah.
What is it called? Is when we get our women professional birth attendants, we sort of reduce, all these complications that come from delivery, some that we may experience now or in future.
True.
sometimes nowadays we know that sometimes the birth experience has effects to the child even 5 years later. You know, we've seen children with difficulty in the education. We've seen children having developmental issues, which sometimes we don't associate with what happened during birth. Yeah. And we've seen women also going through either a very good birth experience or traumatic birth experience that influence their choice, their reproductive choice in future. The people who've said, I'm not giving birth again.
Oh, yes.
Not that we want people to give birth, you know, indefinitely, but let not trauma be the reason why you're making that choice. Let your choice be because of maybe a medical issue, economical issue, cultural issue, but not trauma. We cannot be making our choices based on trauma. Choices made out of trauma are usually not very good choices.
Yeah.
It means people are not giving you a chance to express yourself.
That is a powerful introduction, and congratulations.
Thank
we couldn't wait for you to I couldn't wait for you.
I hope to see I enjoy clinical practice.
Yes.
People might not know, but I am also a politician, not the ones that are passing finance bills, but I am the chairman for KMPDU. That is the doctors' union in Nyanza.
Yes.
So I try to balance that. Ultimately, I will not delve into politics. I enjoy clinical practice. So most of you will see me, apart from being on the streets, I will also be in the wards.
The ward.
Yes.
So it is such an honor. And by the way, we had in the Mamatoto Lounge, we had this list for obs gynaes to come to this show. But what a blessing to have the chairman being the first one.
Yes.
It's such an honor. Asante sana.
Thank you.
So I will pick from your introduction.
Sure.
When you spoke about birth traumas, especially to both mother and father. And the child.
Even fathers.
Definitely, because they carry it. And you
yes.
guys don't talk anything about it. You die with it.
We don't.
It's unfortunate. We'll talk about fathers. But there's this constant backache that develops for mothers. And unfortunately, it's even for both, but it's outspoken for mothers who've had a CS and they had the epidural. What can our mothers know or prepare, or what can they do about it later? But I'm sure number one is, yes, visit a practitioner. But what are these two small basic a mother can comfortably do about it?
Well, fortunately for all of us, male, female, there are those changes that occur during pregnancy that might strain your body, any part of your body. As the baby is developing in the womb, the mother develops an exaggerated back curvature. That sometimes results into women experiencing some back pain, even during pregnancy.
Yes. Yes.
During delivery, especially if it is through cesarean section, some women might also experience chronic pain as a result of the method of analgesia that was used, that is spinal analgesia.
Yes.
Now, how do we deal with this one that is not associated with spinal analgesia? I encourage people to exercise. Even throughout pregnancy. You can exercise throughout pregnancy.
True.
The body tends to accommodate what you are taking it through. Your body, your muscles, your nerves, they tend to acclimatize to what you are going through. So if you are used to exercising, or if you exercise throughout preconception, during your pregnancy, after delivery, then you tend to deal better with lower back pain, okay, than if you do not. And if I just extrapolate a bit, those who tend not to exercise tend to be on that particular scale of the BMI. They tend to be, some of them would be overweight. And you know, I was also very surprised when I realized to categorize somebody as overweight, the difference between overweight and normal is very small. You know, when you move towards 29, when you move to 30, that's an obese person. When you move to above 30 something, that's very obese, morbid obesity. We shy away from using some of these words, but for a medical practitioner, I think it's usually important to tell your patient that mahali unaenda, you will have other problems. You know, a friend of mine was in Toronto, and they have a special clinic, ward, and theater for obese patients, because we realized that this group of people have, you know, they have their own different ways in which, physiology in which they respond to the pregnancy. So when you exercise throughout your pregnancy, or even better, before pregnancy, throughout pregnancy and after pregnancy, you tend to deal better with the back pain. For those who experience back pain because of analgesia that was used, then it's called post-spinal. This post-spinal headache, associated with headache, post-spinal headache, and the back pain. Of course, if you've been exercising, you'll deal better with it. But getting to see a pain specialist, those practitioners, they're anesthesiologists, they might help you deal with it better. That said, there are professionals who deal with pain. Well, they're called physiotherapists. They can also guide you very nicely through this. And just to add, I know I've seen you take some patients through this. There are different ways of delivery. The position we use for delivery in our wards is for my convenience. Unfortunately, let me let that bag out of the car. The best positions are not what we use. Even if you check online, you'll find that on all fours is a very good position. Most animals are on their all fours. That's how they deliver. And they deliver without any help for the animals. So even for the humans, sometimes being on all fours, you remember some of our difficult deliveries, we resort to telling the mother to be on all fours so that we deliver better. What is it called? Water bath deliveries are also better tolerated than the one that we use in the hospital. The delivery in the hospital is uncomfortable for the patient.
For the patient. Actually, when I'm doing the childbirth classes, I tell the mamas and the dads, can you imagine yourself going for a long call when you're on that position, lying on your back? Or is it easier to squat? You know, because even sometimes when you have constipation, you even feel uncomfortable to use the sitting toilet. You want to squat in a latrine. Which one is better? You know. So yes. Next time we'll talk more about labor positions. And we should embrace them now.
Yes, we should.
We should embrace them now. So I picked that because of your introduction, and probably to the next, just to finish on the traumas. Is this pain at the scar site, and mothers associate it with cold. Anytime, even 5 years, you'll hear mothers saying when it's cold, the scar is painful. When the child cries, when the child is in distress, the scar is painful. Is it far-fetched, or it's maternal instincts, or is there anything medical?
So, the pain that women feel on the scar, for us as obstetricians, the most important scar for us, I'm saying most because even the others are important, is the one on the uterus. That is what we are usually worried about. In fact, when we ask you about a scar, we are not asking about the one that is on the skin. The one that is on the skin is one of the access routes. The most important scar is the one on the uterus. Fortunately, the scar on the uterus only comes into play when we are pregnant and we are afraid that we can get a rupture. So that's why for us it's the most important scar.
Yes.
The other scars on the successive layers on the abdomen are important, but majorly to the patient, not unless you're talking about endometriosis, for example, because we've seen endometriotic tissues on the cesarean scars. It rarely happens, but it can happen.
Okay.
So those one with endometriotic tissue on the scar sometimes get that pain cyclically. They will get that pain during their cycles. So that is also important to identify. You realize we don't diagnose endometriosis as we should. A lot of women are suffering with endometriosis, chronic pain, without knowing where it's coming from.
Yes.
But that said, there's pain on the skin. First, there is a documented condition called chronic pain from on the cesarean scar. You can have pain for even as long as 5 years post cesarean section. This is majorly because of injury to some nerve tissue that can give you that chronic pain, or constant irritation of some nerve endings that can give you the chronic pain. Their association with proximity to your child or the weather, I might not quite comment on that.
All right.
Though sometimes it is thought that weather, extreme of weather conditions might also stimulate nerve endings. You've seen people getting frostbite and they cannot feel their limbs.
Yes.
So you can also think about it that way. But over and above, I might not quite draw that close, association with weather conditions.
Okay.
But if one is experiencing that chronic pain of cesarean scar, two things: they can be managed conservatively. We have those pain specialists.
Yes.
We can find ways of reducing that pain. But that scar can also be re-explored. Yeah, that scar can be re-explored. Just open the scar, find out if there is something. Do we have a hematoma that have developed, especially if it's on the short term?
Yes.
We have a hematoma that has developed, a collection of blood in that region.
Okay.
Do we have an infection in that region that has developed? Do we have a stump that is being irritated that can be removed safely?
Okay.
A stump of, the nerve ending that can be removed safely, and we reclose and make sure she does not have any pain.
So basically, ladies should reach out.
Yeah, just reach out and find out what exactly is happening.
We should stop this of hata ya nani huwa inauma, hata ya mama yangu huwa inauma.
Pain is not normal.
Yes.
Pain is not a physiology.
Yeah, it's not normal.
Pain actually is, the goodness about pain is it tells you where
there is something wrong. Yes.
So it's like a warning. Once you get the warning, then you want to go and find out. Yes. And sorry, I might not have mentioned this, but there's this pain that is psychological.
Oh yeah.
Sasa uambie mtu wewe nyamaza, una relax to itapotea. No, when you seek counseling, sometimes also it sorts out your pain. There's that pain that is tunaita, it is not somatic. It is in the brain, and at that point, I think I might categorize those who are saying that when the child is close to them, they feel that pain, or when the child is in distress, they feel that pain.
Yes.
So they can get a bit of psychological help.
Okay.
And they tend to get better.
All right. You talk all this with a lot of passion. How did we get to Obs Guide? How did we get there?
My journey to Obs Guide
yes.
began when I was already a doctor. In undergraduate, we were attending this lecture, and I remember the lecturer then was saying that if you cannot make decisions in a split second, don't venture into obstetrics, because in obstetrics, the child, two lives depend on your first decision making. So if you find yourself always second guessing yourself or waiting for a perfect time to act, then a lot of women will suffer in your hands.
Yeah.
And I was seated at the back, and I remember telling myself, oof, that's me. I don't think I can do obstetrics. I wanted to do surgery. So I came to Kisumu for my internship at Jaramogi, at JOTRH. We call it JOTRH. And one time, outside the hospital, I am just Onyango. One time I meet one of my friends from outside the hospital, and he's like, "Oh, you're a doctor here?" I was like, "Yeah, this is where I work. This is where I earn my living." So he's like, "I brought my wife. My wife has twins. She was here like 2 weeks ago, discharged. She's back. I think she's in labor." I was rushing to theater, so I told them, "Just go in. The nurses will sort you. I have a case waiting for me in theater."
Okay.
So I rushed to theater. Some 6 hours later, I'm called by the nurse in charge of maternity, and she tells me, "Doc, you remember that mother with twins?" And I told her yes. And she told me, "I think we are stuck." So I asked her, "What do you mean stuck? Do you mean stuck like she has not delivered?" She said she delivered her first twin almost 2 hours ago. We have not delivered the second twin. So I told her, "What's happening? Why can you do the maneuvers to get in the second twin out?" She told me, the other nurses have tried. I don't think we should waste any more time.
Okay.
I think she's bleeding. So I told her, "Okay, I am intra-op.
Intra-op.
I am in the middle of another surgery.
Okay.
So what you do is just prepare a list and bring the patient.
Yes.
So that we can try and deliver on the operating table. If it's not possible, we convert to surgery."
Okay.
So kumbe, she was already actually on her way to theater.
Hey, action time.
I finished my case, and I find the patient is waiting for us outside the operating room. So they cleaned theater, prepared for the next case, brought her in. We did the CS very fast. We did the CS very fast. Baby was okay. I was happy.
Yes.
You know, a lot of us in obstetrics, we say that when the first cry of a child, so I've reversed the horse and the cat. The first cry of a child makes you very excited about whatever you have done. So I was very happy that I have saved this child. You know, my friend will be very happy.
Yeah.
So I did my case, finished, and I was coming back for night. And this really is also one of the things we really fight. I'm really fighting as now as a politician.
Yes.
Where you are working for 24 hours. So I leave the hospital. I go to my place. I want to freshen up, take supper, so that I go back to the hospital for my night duty. Remember, I've been in the hospital the whole day. Yes. So I have a night duty to cover.
Yes.
So I get to the house, you know, freshen up, take supper. 8 p.m. I left the hospital at around 6 p.m. 8 p.m. I'm back in the hospital.
Does this usually happen to most of the doctors?
Sure. This usually happens. And it is quite a big problem that we will keep on reminding our people, our politicians. But now I think we need to involve the public so that they demand for that quality.
True.
Because there will be questions of quality if somebody has worked for 24 hours. And you see, it's not working.
You've been standing in theater the whole 6 hours.
Yes.
Have this a short break for yourself.
2 hours just to take your supper, to shower.
And what's of it is that you're handling emergencies and emergencies.
Yeah, one after the other.
One after the other. Uh-huh.
So I get to back. Maternity.
Yes.
I have to sieve patients, organize them in order of priority, emergencies. So I'm doing that. And the nurse who covers the whole hospital comes with a file, and she tells me, "Oh, doc, have you prepared for our mortality?" We discuss all mortalities that happen in the hospital, especially maternal, because and you will agree, being pregnant is not an illness. We do not expect a mother who is coming to deliver to die.
Yes.
They're not sick. They're coming to give life, and we expect them to give more life.
Yes.
So within 24 hours of a death, that case must be discussed properly, and we come up with measures to prevent such death within 24 hours, so that the case is very fresh in our minds, and everybody who was involved is present. So I told her, I don't think that is my case. I told the nurse, I don't think that's my case.
Yeah.
I did my case. The surgery was successful, and I think the mother was taken to the ward. She told me, no. Yeah. I asked her for the file, and I opened. I was like, my goodness. I wanted to see it for myself, so I left everything. The patient I was seeing, I just left her seated there. I told her, just 1 minute. And went to ICU to see, because the patient was admitted to ICU. I opened, they were covered head to toe, where we usually do for our deceased. I opened the cover, and I was like, oh, what happened? So my friend, who I met when I was going to theater, I met my friend coming in with shopping, The wife has delivered twins.
The same person that you met in the morning.
Yes. This was the wife. He does not know. He has just come in from shopping. So I met him at the entrance, and he's like, hey, how did it go? I could not answer him. I could not answer. You see, his face had lit up. Huh?
Yeah, all hopes.
Yeah.
Enjoyment.
My babies are waiting. You see, but that's what everyone thinks when they take their wives to the hospital.
True.
At the end of the day, they want to go back home with the wife and the children. And a lot of men think about the children.
Yeah.
For him, he wanted to know if the children are okay.
Yes.
But we had an even worse news. You see, that the wife was not
going home.
Yes. So I remember that night was very difficult for me. Nothing was moving. I kept remembering that lecturer saying, if you cannot make split decisions, you will lose 2 people. It kept ringing in my mind, and I was telling myself, my goodness, am I really supposed to be doing this? But I remember after the mortality review, we have very nice mentors in our department at Georgia Rate. I really have to say that.
Yes.
And one of the things that came out from that discussion is, this should not happen again. And there's one doctor who asked me, Onyango, is there something we can do for you to make sure that you regain your confidence in taking care of our patient? Because if you lose that confidence, this might repeat itself. Not because you are a bad doctor.
No.
But because something has happened and we are not catching it, even within yourself. We need to make sure that all our doctors can, wake up every day in the morning and sort out our emergencies.
Oh, wow.
And I remember he would call me to his house for supper, just so that we talk. He just wanted to make sure that I'm okay.
Yeah.
And that really made me say, I think I can do this. I think I can make amends. That's how I got into obstetrics. That's why I think I want to do fetal maternal medicine. Not because I'm making amends, but because I feel I have that confidence to make sure that our women who are coming to deliver or who are getting pregnant in the absence of illness are okay. And even those ones who have any medical illness, we can transition them slowly to that point of delivery safely. And if they are not supposed to get pregnant again, we can advise them. If they can get pregnant again, we can
walk with them
through that journey of pregnancy.
That was scary. So do I assume that this was your worst experience or near?
That was my second worst experience, of course, but the goodness, it guided me to where I want to go.
Yeah.
It opened my eyes to really where I'm supposed to be.
Yeah.
Yes.
All right. So, and probably the happy moments are so very many, but please pick one. One that you don't forget.
Well, my happy moments are all my happy moments are during deliveries.
Okay.
All of them
Uh-huh.
are during deliveries, when the delivery is successful, especially if you've walked the journey of that mother who had difficulties getting pregnant.
Yes.
They get pregnant,
Yes.
and you walk with them throughout the pregnancy and they deliver.
Yes.
That's usually
Happy moments.
yeah, it makes me happy. You go home and you feel like I have actually done
I'm
what
seeing
I
it
am
on your
supposed
face.
to be doing.
Yes.
Yes. And there are quite a number. I might not be able to choose one specific one,
Yeah.
really. Yes, because
At least there are many.
faces and cries, babies' cries, and they're just flashing in my face. I might not be able to pick one particular one. Yes.
Okay, but my joy is that at least as a person you have both moments.
Sure.
You have those times that you just want to remove your gloves and go to the cold room or sit down and and there are those minutes that you're like, yeah.
We have them, and just to balance, as an advocate for healthcare workers,
Yes.
I don't just advocate for doctors only. I feel like our hospitals should embrace debrief for our healthcare workers.
Yeah.
Breaking bad news in itself is difficult for you.
True.
Telling somebody that we have lost your wife, we have lost your child, it's not easy. It's very difficult because you experience that emotion, that raw emotion with that mother, with that father.
Yeah.
It's very difficult.
It is. Yeah.
From my experience, we did not get that very good debrief. Even for my other colleagues, maybe I was fortunate enough to have one person who felt like we cannot let this one slip into the cracks.
Yeah.
But what about the others who were part of this team?
True.
Did they sit down with somebody and somebody told them that you did your best? Unfortunately, for the mourning relatives, the first in line to receive beating is usually the healthcare worker. And sometimes you did actually your best. When a mother loses their child and they feel like somebody did not do something, it is you they will come to first. While deep down your heart, you know that I actually did everything humanly possible to make sure that the mother is safe and the baby is safe.
Yeah, that's a very important thing that we should work around it on debriefing.
Yes.
Actually, in this particular podcast, that is why we want to feel you as a person first before what you do to others. We want to learn that you have these moments as well.
Oh, yes.
And when it comes to debriefing, we should have this safe space.
Sure.
For our healthcare workers, not just covering head to toe and moving to the next patient. Do we give them a moment, and how available is it?
Yeah.
And affordable is it,
Yes.
Or the wards are so very congested, so you are moving from one bed to another. Now when you go back at home is when your husband, your children, or your wife now gets the rough time.
Yes, they bear the brunt of your seeming failures, frustrations. You might download them
to them.
They're trying to reach out to you in the evening. Your son, your daughter is trying to make a joke or sing to you what the song they learned in school, and you are a shell of yourself, and they also withdraw from you. Now they will go and sing to the other parent or the auntie, because wanangalia the father is not there. Because these things will play in your mind for some time.
They will. Talking about that, you're a daddy.
Yes, I am.
Congratulations, Doc. And we are just one day post Father's Day, so.
Thank you. I am waiting for gifts.
Oh, gifts are coming. Did your values change maybe for the better now that you are a daddy? At one time when you are practicing, when you are not a father, does it change you as a person? Do you look at things differently, adding on to your anticipation when your spouse was pregnant, or nini wale wase?
Well, the experience is let me say, when you are on the other side, it's a bit different. You have the same questions that every parent would have. You know, you're worried about the outcome.
Yeah.
Maybe you have more questions because you have an idea of what could go wrong.
Yes.
So sometimes you are tempted even to be there physically to make sure you see everything that is happening. Sometimes you're tempted to call the primary doctor and tell them, why don't you do this? Give them ideas of what they're supposed to do.
Yeah.
But because also we know that that level of interference gives the doctor a difficult time to make that decision that is devoid of emotion, or emotion especially. When I say emotion, it means that it's like I am blackmailing you to do something for me because you know me, or because you fear that if I do something wrong, and Onyango is a doctor like me, they will know that I've done something wrong, and they might want to take action. Yes. But maybe the experience of parents during delivery and during pregnancy should change in Kenya. We've seen, not that we want to ape the West regardless, but I feel like when our partners have that social support from their spouses, it makes life a bit easier.
It does.
For them.
Yeah, it does.
When you are delivering in a hospital with strangers intruding into your private space, if you're a first-time mother, of course, it's a very traumatic experience for you psychologically.
Yeah.
But when your partner is around, you might get that bit of comfort
that it takes.
That you feel like, I think I can do this.
Yeah. Beautiful. Now that we feel that we know you, there is a big question that has been asked over and over and over. Daktari, lazima VE. Kuna kitu inaitwa, ama mnyama anaitwa VE. VE is the vaginal examination. I will not let you go before you tell us. VE. Our viewers have asked about the VE. So our viewers, tafadhali, it's now time for us to understand, why must they do VE if they have an upcoming tool to do the same, like a thermometer? I don't know. Daktari, we want to understand VE. Why must it? Mnakuanga mkitafuta nini huko ndani? And during the birth classes, I use this as my uterus. The cervix is here.
Okay.
So, mnatafutanga nini huko ndani? The babies, the fetus is here.
Huko ndani. For the patient, I think what lessens the burden of the trauma of vaginal exam is knowing what is happening to them, and what does she expect from that experience, because vaginal examination is intrusive. That's why people are asking questions about it.
Yes.
We have no tool to visualize and to give us a feel of the cervix or of the vaginal wall. Okay, if we can invent that, then we might have sorted out the issue. To the patient, our vaginal examinations are usually warranted. By the time somebody is doing a vaginal exam that is not warranted, that is a sexual assault. Yes, even for healthcare providers.
Okay.
It is a very unfortunate thing if it happens without knowledge. It might happen to some people without knowledge, but for everything that happens to you as a woman, you have the right to ask, why are you doing this to me? Even if it's just temperature. Yeah. You ask, because you need to have that information. So if I'm doing a vaginal exam for you, then I have to explain to you why I'm doing it and what I'm expecting to find. And most of the common reasons for the woman is that we want to, if there's bleeding, we want to see where exactly is the bleeding coming from. We want to see. And that's why we we do the speculum. It's also another form of vaginal examination.
Oh, yes.
Okay. If it is, and then if it is something like discharge, we want to categorize that discharge. Is it a purulent discharge? Is it a serous discharge? If the woman is pregnant, is it the amniotic fluid that is coming out?
Yes.
So we put a speculum to see.
To see.
Okay.
Yeah.
In the absence of pregnancy, if there is discharge, apart from seeing, we might want to feel if there is a mass.
Oh.
Okay, kama kuna uvimbe. So we would do a digital exam. So vaginal examinations can be a speculum or a digital vaginal examination.
Okay.
And to move even further, sometimes we do a vaginal and digital, a vaginal and rectal exam. And the reason we do this is because the vagina and the rectum are opposing each other. So if there's a mass, we want to see that this mass go infiltrate into the rectum.
Okay.
Because you'll see some women will have that bleeding, and also they have some constipation that they might not know is associated with this, or they might have some blood in stool, but they don't know. They think that maybe it is just blood, the PV bleeding that has contaminated the fecal matter, and yet there's some communication between the vagina and the rectum. So these examinations are very intrusive, but they are very necessary, especially if they are indicated. For the woman, ask, why are we doing this? And you should get that information. For the medical professional, take the patient through whatever you want to do. Tell them that this is why I am doing this, and this is what I expect to find or not, and this is what we are going to do in case we find this or that.
That is amazing. Absolutely amazing. But now I think I pick it that women have a concern because, and especially our first-time mothers, when they are telling their labor and delivery stories, particular one was saying that, hey, mimi I was told, panda kwa coach, akapanda kwa coach, lala, akalala. Uko na suruari kwa nini? Nobody told her she should be removing it. So she's expecting a pimwe, and I'm imagining a first-time mother, she's like, okay, wanapima nini? Probably at the ANC they were doing the, so she's expecting the same to be done. So I think the medical practitioners should.
We have that work cut out for us.
Please do.
We don't talk so much to our patients, and we might give that excuse that patients ni wengi, so I want to move to the next patients very fast. But one of the things I learned is that I would rather see 5 patients properly than you see 100 patients and you've given only 20% of them what they're supposed to get. The other 80, they are the ones who will complain. They are and they are complaining rightly.
True.
They are the ones who will say that they did not get proper care. They're the ones who will say the care was negligent.
And probably make others fear even, those bad stories that we are afraid of.
Exactly.
So for mamas, please, these are the things that you should know. Just take your time. And I actually request them to make sure that they have a relationship with their care providers.
Yes.
Just ask. It's about your body. Own your birthing story. As we wind up, you have done a very good job. And goodness, I'm so proud of you.
I hope so.
You have. So I really request you to, right now you're a senior. Hey, kitambo sisi, when we were in school, our consultants all had white hair, or some elderly,
I have some white hair. I don't know.
You are not at that place where I would say, nowadays, consultants, you guys are very young, and we are happy because you are having a good relationship with even the younger patients. So at the moment I'll call you senior, please talk to that young doctor or even that young student who is trying to navigate. Do I do law? Do I do medicine? Do I do? And also that one who is already a doctor. This month or next month that we are having our interns now, next month.
July,
July. So they are coming with a lot of expectations, and it is through this internship journey that they are going to make those tough choices of what next. please take a second and talk to them.
Hey, that is like a whole lecture.
I know.
I think for our students, and I want to start from our high school students. Medicine is still the place to be. We still need more doctors. We still need more nurses. We still need more healthcare professionals. The decision to do medicine should not be solely because you feel like they are better paid. Of course, medicine is a profession that needs to put food on your table. But it needs to, you need to have that heart. Lazima ukuwe na hiyo moyo wa kufanya kazi as a medical professional. I think that's the most important thing. Medicine is difficult psychologically, physically. You wake up at 5 a.m., 3 a.m., 2 a.m. It's demanding. It takes a bit of you, from your family, from your friends. But it is very rewarding when you can interact with a fellow human being and you can take them from pain to free of pain, from a frowning face to a smile, because that is what we experience in the hospital. But not all sunshine has no rain. Sometimes you will experience loss, you will experience complications. What you need to do is to have that relationship with your patient and talk to your patient. It saves you a lot of pain. It saves you a lot of reputation if we do that. But ultimately, I have to say, this talking to our young colleagues in terms of care is a whole, it's a whole package. Maybe you can even organize a conference for our young doctors. I think there's so much to say about our young doctors. Maybe for the general viewer, the old doctors were old because there were very few, and you would see them for quite some time. But nowadays we have younger doctors. Do not be afraid of them. Yes, they are very well trained and very capable of taking care of your maladies, taking care of your children, of your mothers. Yes.
Beautiful. That's amazing. Asante. So, here we are. We've come to a conclusion, and that is Dr. Onyango. He is here. He is available. You can always reach out. And above all, something that is very special about him is the political aspect, because we all need all systems together to take care of each one of us. Asante sana, the Little Cave, for having us, for hosting us. And this is brought on your table courtesy of Chanuka Studio. Their offices are at Kondele. Please visit them or invite them when you want to shoot a video, photography, and continue subscribing, continue sharing. We are here because of those unfiltered stories. Each person has an untold story. Till next time, I remain your host, Shikari Rosemary, and bye.